Welcome to another episode of Rich Politics. Thank you so much for taking the time to tune in. Don't forget to hit that subscribe button. Well, joining me on tonight's show is Rebecca Butler. Many of you come across her on social media. She's a former senior nurse and a trained barrister for 20 years. And we're going to be discussing a whole load of things from lockdowns to vaccinations. And she joins me now on Rich Politics. Well, Rebecca, thank you ever so much for joining me tonight on Rich Politics. We've got so much to talk about in such a short space of time, really. And of course, the big news at the moment, all this week in our media and the press, has been vaccinations. And we know coming this week is going to be starting to roll out in different categories, different age groups. And, you know, a lot of people have been very suspicious of this vaccination. You know, we've seen conspiracy theories. We've seen people saying Bill Gates is involved from 5G. I mean, all kinds of crazy notions have been branded about. Even my own friends, I'll be honest with you, across social media, they've been saying to me, "Oh, Rich, you know, don't have it." You know, my position, so my viewers know, I'm not an anti-vaxxer. I'm not against the vaccination, but I am cautious. I'm cautious for a number of reasons. Cautious for the simple reason it's been rushed through regulation very quickly. Vaccination found in such a short space of time, I find that extraordinary. And secondly, the fact that these companies like Pfizer and BioNTech have been excluded from any form of liability or prosecution should anything go wrong. And that really troubles me. But before we talk about that, and I know that you've been quite vocal on this all across social media, and you've got very strong opinions on it, I want to talk to you about the lockdown, because you're a former senior nurse, and you will know a lot of people out there who've had cancer appointments cancelled. They've had, you know, life-threatening diseases, really, in some cases, and some of them have died because of some of these cancellations. Do you think the government have done a good job on this lockdown when it comes to the NHS and these patients who have been suffering as a result of these cancelled operations?
I think that it's probably a bit too broad to say, has the government failed? Because I think you always have to take things back to the decisions made at the time. Now, you will recall that when lockdown was first announced, I think it was the 23rd of March, it was only for 3 weeks. And, you know, in that context, what they did was probably right. Now, one of the biggest problems with the UK having quite a high mortality or early mortality from cancer, if you look at across the EU nations, is early diagnosis. So one of the problems with us as a society is we don't tend to run to the doctor fast enough. Believe it or not, because a lot of times you hear people saying the narrative is different, but actually early diagnosis is the key to better survivals. I think that cannot be disputed by anybody. However, some cancers, and I think this was the decision taken, they can afford a 3-week delay. That's what I thought. And so, or that's rather what I think they were saying. And I don't think that's wrong. I think somebody would have had to make a very hard decision. What we're looking at with those patients is the people who had just been diagnosed. And what we did know at the time was that this virus was putting a lot of people into hospital. It had an R value, sort of 3-ish, 3 to 5 in some estimates. So we couldn't risk putting newly diagnosed cancer patients who were going into hospital for their pre-treatment studies, their pre-chemo, pre-radio. We couldn't immunosuppress them, knowing that if they did catch it, we would basically be killing them. Somebody had to make a very hard decision. Then the lockdown became not 3 weeks, but 3 months, because, you know, you will recall the daily death statistics being shown. And you could see that actually the 3 weeks lockdown didn't have the impact that they thought it would, despite the fact you could see that people were not going to work, not using public transport, not socializing. People complied and the numbers weren't falling. So the policy they started out with was harsh but okay. It then unfolded into a disaster. And that was what my article really dealt with.
Yeah, I read the article, and one of the things I'd like to ask you as well is when the government were publishing from Public Health England, and certainly here in Wales as well, because we have our own National Health Service, which is a mess anyway, won't come to that in a minute. When they published the number of deaths, I noticed we're over 60,000 now in the UK, and there's always a little like terms and conditions bit at the bottom where it says, you know, they died within 28 days of testing positive for COVID. So those deaths are not necessarily people who have died from COVID, but they died
when they had COVID. That is the reality as well, isn't it?
Or even that they died having had COVID. And now this goes to it being a notifiable disease, because at the time, certainly, we were in a pandemic. And so there are different reporting requirements on doctors. There's a whole interplay of problems with this, and public trust was eroded very quickly. Because GPs couldn't go into care homes, senior nurses were given delegated powers to fill out the death certificate. And so, for example, mass inaccuracy could have occurred because a care home with a positive COVID case could put COVID on the death certificate, maybe not at the first entry point, but lower down the list on the death certificate, if somebody died prematurely. And the nurses were having to call up the coroner's office and say, well, we weren't expecting them to die, but they have died. They were 90, so you are going to die when you're 90. Do you have COVID, yes or no, in the care home? Yes, we do. Well, COVID has to go on the death certificate. This started to erode public trust for obvious reasons. And so there was also at the time a requirement to know what the long-term effects of COVID were, because we started to see a pattern. This wasn't necessarily a respiratory disease, it became an inflammatory disease. So there was a requirement to know what the 3-month outcome of people who had had COVID looked like. Many people will know that in July that changed from 3 months to 28 days. So now it's within 28 days of a positive test. This is really, I think, going back to is it an inflammatory disease or not? Because in people 50 plus or 60 plus, particularly it would appear people of Bangladeshi origin, bizarrely, they tend to suffer greatly from the inflammatory condition. And you have cases of normally fit and well 50-odd-year-old men dying within 28 days of getting better from COVID. So again, this is health monitoring numbers, but the death certificate has a series of entry points. And so primary cause of death, in that case I've just explained, would be heart attack or stroke. And then 1B on the death certificate will be COVID, because it was in the last 28 days. These are health monitoring things.
Well, I was going to say that's very helpful, because clearly, it's not communicated as clearly as you've just put it there with the mainstream media. Of course, there's lots of talk out there on social media, and it's like it can be quite toxic sometimes over the whole thing being a pandemic. I've been inundated with stuff from friends, who I regard as close friends, with all kinds of crazy aspersions about the whole pandemic, that it's a global reset. It's something that, Bill Gates is involved in. We'll come to the vaccinations in a moment, obviously lead on to that, because it plays into the whole idea of it being a pandemic. I just wonder what you think about that, because I don't find it very helpful for the public, because the mistrust you've talked about then in any future idea of a vaccination that can help, people will have great reservations for the simple reason what's being promoted across social media, which isn't really the reality, is that this has been planned from day one. What do you say to those people who call it a pandemic?
Well, I have always been an advocate of looking at the hospitalization numbers, because actually the government's aim was always to reduce the strain on the NHS. There is no doubt that this virus, first of all, has an 80% asymptomatic carrier rate. We know this really right from the start. The Diamond Princess cruise ship was the best laboratory experiment the world has ever done on this virus, because we know that 80% of the passengers who were all tested, 80% of them were asymptomatic. It's the 20% you worry about, because when you're looking at pandemics, when you're looking at a situation where you've got a highly replicating virus, not in the Ebola scale of things, not in the measles scale of things, but in terms of seasonal flu it's double the transmission rate of seasonal flu. So you can't allow the spread because of the 20%. And it's the 20% that caused the problem for the hospitalization. So I think the people who think this was a planned release of the virus need to find a little bit more evidence than what somebody says in a YouTube video about it. Now, they kind of use their pandemic argument based on PCR tests, but they don't trust the PCR tests. They say the PCR tests are wrong. To some extent, they're right. The PCR tests are not 100% accurate, and they do record 1% false positive. Again, big government failure. Matt Hancock did not understand the false positive rate when he went on the Julia Hartley Brewer program, but neither did she. Okay, neither of them understood what the false positive rate was. The false positive rate is 1%. As an average, it's a little bit more, 0.7 to 1.2. That is of all cases tested, not positive cases, all. So if you do 1 million tests, 1% of them are accurate. That's 10,000. If you're then getting 20,000 positive cases a day, 10,000 of them could be false positives. Government failed yet again in getting that message across. They actually didn't know the false positive rate. The PCR is not the best measure of this disease because of the coronavirus virus looking like all other coronaviruses. It's not perfect, but you have to look at it in relative terms. So relative to what a PCR test looked like with all its inaccuracies at the start of April, compared with the relative numbers in the middle of April, you can't dispute that there were more positive cases, false or not, the relative numbers have gone up. And that's the way I look at PCR and say, well, if you don't trust them at all, you can't say whether there is or isn't a pandemic. If you do trust them with the reservation that there are false positives, then look at the trend, including the false positives. There is no doubt that there is a virus that is atypical, that the genome was unique, and we didn't know how to treat it.
Yeah,
and it puts.
I think, sorry to interrupt you there. I think for me, because it's affected me personally in the sense, I know close friends of mine, like one of my very close friends, his father passed away and it was from COVID. He died, he had a low immune system, he caught COVID and passed away. I mean, so I think when it touches you personally, you know, you begin to realize, you know, this isn't all this pandemic stuff. It actually hurts the people who've lost loved ones. It hurts them. You know, clearly there's an emotional attachment to it and I think that's where people show no level of sensitivity at all. I mean, I'm trying to be balanced, you know, the whole I do this broadcast, we have all kinds of guests on, including, you know, people who might be anti-vaxxers. I don't care who comes on here to express their opinion because I believe in freedom of speech and open debate. But what worries me is, going back to what I said earlier, is when this is promoted as a pandemic and, you know, all these conspiracy theories, it really doesn't help the battle against COVID, which is a reality. It is killing people. And it's, you know, it's a virus that is rampant all across the country, across the globe. And surely there needs to be some kind of, I know that YouTube, Twitter and Facebook have launched I think it's a campaign they've launched, or some public inquiry they're doing into doing a fact check on everything that goes out on their platforms to make sure if there's any anti-vaxxers out there that are, you know, putting stuff out. And we'll come to that now in a few moments. For example, this is a Bill Gates project because he's pumped millions and billions of pounds into vaccinations over his life. I just wonder, you know, whether the stories that people are promoting like that are helpful, and is there any truth in those stories?
Well, I think with a lot of conspiracy theories, there actually could be a grain of truth. And, you know, I think I myself have put forward a thought, and it could be conceived as a conspiracy theory. I've always felt that because this was reported in the, October the 17th in the South China Post, this virus must have been in circulation well before October the 17th, because That's a Hong Kong newspaper.
Mm-hmm.
You're looking at a Chinese doctor who was an eye surgeon. They're kind of the last to see this sort of thing. How many respiratory doctors were seeing a new style influenza, they probably thought, or a new style coronavirus, and just were treating the patient and not thinking, hang on a minute, shall I actually look into the genetics of this? So I think it could have been out a lot before October the 17th. And actually, unfortunately for some, I've discovered how to do polls on Facebook. So my poor old Facebook followers are now being inundated with polls. But I did ask them, I think it was yesterday, when do you think you had this virus, if you think you did? And a lot of people have come back and said, why didn't you put a button for pre-January 2020? I went skiing, I think I had it. I was in Portugal, I think I had it. I was in Sharm el-Sheikh, I think I had it. Loads of people were keeling over with this same disease. So in my own way, I've posited a conspiracy theory, haven't I? Because I've said, I don't believe the Chinese numbers. A lot of people will agree with me. So have I promoted a conspiracy theory? Probably, but I've tried to use some of the evidence, and it wasn't just that, but there is some evidence to suggest by somebody who did mobile phone studies that the lab in Wuhan had an emergency shutdown. So there you are.
Yeah, I think the key thing is what you mentioned there. It's the evidence, isn't it? I mean, when we look at any theories that are promoted out there, it has to be backed by evidence. And as you've rightly pointed out, I mean, my experience, as you've just mentioned there, people, this virus was about before it was made really public. I think my wife, myself, my kids, all 7 of us, 5 kids and 1 wife and 2 wives, we were really poorly in the December, really before they mentioned it in the new year. And it was like flu-like symptoms. We were all in bed. We were out for about a week. It was really awful. And I still think I had it then. There's a reason why I think I had it then and came through it, because I'm a healthy, I don't have any other underlying conditions, as it were. I think it's because I was out a couple of months after that with some friends of mine in a pub watching rugby. And while the game was on, the lady behind the counter, the landlady, a friend of mine, one of my local pubs, she contracted positive for COVID. So she contacted all the people in the pub that day. I was one of them. I was out with 6 of my mates. So they all got tested, and I got tested at the same time because we needed to, because she obviously tested positive. They all came back positive. I came back negative. And I'd been with them for 4 or 5 hours in the pub. So I often wonder whether or not I have built up some form of immunity to it, because clearly out of 7 of us, 6 of them got it and I didn't, but I was poorly in the December before. So I just wonder if there is some truth in that from my own personal experience. You can't base, evidence on someone's personal experience. I get that. But for me, that's what I've experienced. And I think there's a lot of people out there, as you've mentioned, that feel very strongly that they already had the disease prior to it being known to the public.
Yeah, I mean, when I ask my question, I'm sort of, I'm trusting my Facebook pollsters to essentially know the difference now between what flu feels like, what a bad cold feels like, and then knowing what the symptoms are for COVID, which actually are quite wide-ranging and similar across the different viruses, the seasonal viruses. So I do trust them to know that this one was different. My mother, who actually doesn't live that far from you in Wales, she's convinced she had it back in December, and she had a cough, fever, some of the classic symptoms, but didn't have an X-ray, wasn't admitted, wasn't tested, obviously, but she's convinced she had it, and we're going back to December. So I don't want to advance this as a established fact. I would never say it is, but I look at, was there a release from a laboratory? October the 17th, I've got the press cutting. It was reported. I think there's sufficient evidence to know that the doctor was silenced, then exonerated. Plenty of that from the Chinese press. And then regrettably, that poor old doctor died. There's not just one doctor saying that. It would have been observed by a significant cohort in hospital medicine before it ends up in the press. So I believe it actually emerged earlier. So is that a conspiracy theory?
There's lots of them out there.
Yes.
I was going to say, let's just move on a little bit, because obviously this week, as you know, politicians have been celebrating the fact that the vaccination is ready to roll out across the country. And as we've already mentioned at the start of the program, you know, there's a lot of caution out there. A lot of people are suspicious about it because of the speed of which has been put out there, and many other reasons as well. I mean, let's talk about some of the myths surrounding the vaccination. I mean, you've been quite vocal about this and you've spoken out about it. Do you want to talk us through a little bit about your thoughts on the vaccination as it currently is?
Well, we've got, I think, 200 candidates. In the UK alone, 1 million people volunteered, myself included, for the candidate vaccines. I volunteered into the age group testing. So a lot of people have come forward. A lot of people.
What is that? Your 20s, is it?
Yes, that's right. Regrettably, I am just in a risk category. Yes, so a lot of people have come forward, and we've got 2 novel style vaccines, the mRNA, and then the rest are altered coronavirus vaccines. So we got some chimpanzees, we've got some just from it's a whole array of coronaviruses, not influenza viruses, coronavirus, where they've extracted the lethal bit of the DNA in the virus and just put in the neutral DNA when they vaccinate you. The mRNA is slightly different, and that, I think, again, apologies to my Facebook and Twitter followers for putting these polls out. There was a good reason for it, because I am writing an article on this vaccine fear.
Yeah.
And I think the new ones are the least trusted of all, the mRNA ones. And there are 2 candidates at the moment for that.
Well, talk to me about this vaccination fear, this stuff that you've been working on and you've been speaking about. I know you've been very vocal, as I said, across social media. What is it that the public is fearing, and you know, what is it helpful? You know, what's happening right now with all this scaremongering that's going on around the vaccination?
Well, again, this is why I think these people should not be cancelled, because my research, which is not controlled research, it's just bang a poll out on Twitter. My research shows me that a significant proportion of people are not anti-vax. They are hesitant about the coronavirus vaccination, and they have a list of concerns about why they are hesitant. So I don't call them anti-vaxxers, because they're not. Anti-vaxxers, actually, you're looking at less than 5% on the polls. You're more looking at people who absolutely won't when asked, or would if they were more reassured. Now, again, I keep going back to the fact that our failure is government ministers are not science graduates. They don't understand the science. And when they're put on the television and radio interviews, they cannot answer the science. And I think this is a big failing, that all of our politicians and our media are Oxbridge educated humanities students. We do not have the breadth of scientific understanding, even in the people who are leading the narrative. So they can't answer the specific concerns, and the media are not raising the specific concerns, which is why this sort of show is helpful, because we look at social media and we do know what the concerns are. So we're talking about the hesitants, not the anti-vaxxers here. And you're looking at 60-odd% of people who responded to me in my little Twitter poll are saying not anti-vaxxer, but don't trust this one. It's about trust.
It is about trust. And it's very difficult for people, isn't it? Because, as I've said, you know, I've got emotional attachment to it, because I've known loved ones that have died as a result of it. And I'm a father. I've got 5 children. I'm thinking of them, you know, and their future. I just, going back to some of these myths, I mean, the one that seems to be working its way around social media quite a bit is the whole Bill Gates thing, that somehow he's involved, and, you know, he's come up with this idea, he's funded it and all that. What do you think about that?
Well, I mean, that's a whole program on its own, talking about what this is done. But one, actually, if I can just hone in on one specific thing, when I put out that if MHRA approves the vaccine, I'm having it, somebody came back to me with a screenshot of MHRA and who funded them, and Bill Gates was one of them. Now, that went viral, and now suddenly, every time I look at Twitter, I see Bill Gates hashtag that he's funded the MHRA. For the purposes of this program, and I'm more than happy to go into what Bill Gates has and hasn't done, for the purposes of this program, I can tell you without any shadow of doubt that Bill Gates' funding of MHRA, which is the regulatory body that looks not only at drugs, vaccines, it also looks at medical instrumentation and procedures, he has funded them solely as a regulatory body for Africa. So it's almost £1 million, I think. The almost £1 million has gone to make the UK regulator the Africa regulator, which I think is a great thing. And anybody who's a Brexiteer will say, well, this just proves why Britain is a leading country and shouldn't be worried about Brexit. This is further evidence of that. But a lot of people think that because Bill Gates has paid for it, he is able to corrupt the registration process. And when you say, well, actually it's independent of government, it's an independent body, people don't trust that. And they think, well, why has it got Bill Gates's money? It's got the Bill Gates's money on behalf of Africa. That's the answer to that. People may or may not believe it. I have no control over that.
Of course. What about some of the other conspiracy theories you've come up against? Do you want to tell us a bit about some of those? Because they've been quite absurd, haven't they?
Well, some of them are absurd. I don't believe anybody planted this virus deliberately. Certainly not the individuals who are being accused of doing it. You know, I know there's another one about China. I reserve my position on China, and given what I've just said about disclosure and honesty. But do I think this is all part of a global reset? No. Do I think that the World Economic Forum is, showing a preference for having a pandemic? No. The World Economic Forum is only an NGO. It's only a think tank. Yes, it's highly well attached. Is there a conspiracy between Davos, all the governments? Frankly, anybody who thinks our government in particular is capable of a conspiracy on that level is seriously overestimating their ability to even do that logistically. And then to do it without leaks is almost impossible. Yeah. So I find that conspiracy just so unbearable. Bill Gates, nanoparticles, no, you just can't go down that. That's just no. One thing that people have said, though, is DNA change.
Yes, that's been a big thing, isn't it?
Yeah, and actually that is something that does need addressing, because that is a concern. Now, by the way, viruses change your DNA. So viruses and influenza, they are viral particles, and they do click into your DNA. As a part of the genome, there is a small percentage, but still quite a high percentage, at 20% of your genome is actually viral particles. But then, as some people say, 97% of our DNA is similar to a fruit fly. So, DNA, when you're dealing at the really, really tiny level of the genome, people are concerned, understandably so. So the messenger RNA, what it does is it patches a bit of the viral particle into a muscle cell when you have the injection in your arm, and then it makes those muscle cells look like coronavirus cells, specifically with the spike protein. And because your body then thinks you're being exposed to coronavirus, what it does is it produces antibodies to the spike protein. The difference between that vaccine and the AstraZeneca vaccine, which is the one, interestingly, that people trust more, is that they give you a deactivated coronavirus particle. So the lethal side of it is removed. And they've done this from chimpanzee studies. The body then sees the viral particle. It sees a cell that looks like coronavirus and then produces antibodies to the spike protein. So in both cases, your body is producing antibodies, but in the mRNA case, the mRNA is making your cell look like a coronavirus. So it's going one step back. The AstraZeneca vaccine is a coronavirus, albeit destabilized. Why people are worried is the relationship between mRNA, messenger RNA, and your DNA. But what we have been told is that these cells do not reproduce. So once your muscle cell has had that mRNA particle in it, it doesn't go to a second generation. The cell dies and doesn't replicate. This is why you need the vaccine 3 weeks apart, because the cells die off, and then you reintroduce the body to a little bit more, and then produce more antibodies, because you need a certain level of antibodies, particularly if you're elderly, to fight off the virus when it hits your nasal or oral cavity. So the fact that it doesn't reproduce the cell into a second generation should be the reassurance to people. But again, they don't trust the science.
No, I think yeah, you're right. And as you say, the messaging from the government hasn't been helpful around this whole thing either. And I think one of the things I remember, we talked earlier this week, and you mentioned, I mentioned to you, Ashley, I said, what do you think about the possibility of a mandatory vaccination? Health Minister Vaughan Gethin here in Wales, a few weeks ago, he mentioned that they hadn't ruled it out. So he didn't say they were going to do it, but they hadn't ruled it out, which caused, this was, a lot of people concerned about that. And I think you talked about consent and informed consent. I found that very interesting. I've been thinking about it all week before we got to speak tonight. Just wondering what you mean by that, consent as opposed to informed consent when it comes to the vaccination.
Well, when you have a vaccination, or when you're a lot of your parent viewers, and you will recall that some health authorities actually ask you to sign off on behalf of your child. Yeah, give them the neonatal, the early childhood vaccinations. Yes, I consent to you assaulting my child with a needle is what you're actually consenting to. When you receive that vaccination consent form, certainly my understanding is that you are not given a list of possible side effects from those vaccines. It's just, can I assault your child, yes or no? So that is very different to, for example, getting the yellow fever vaccine, because when you're an adult and you have the yellow fever vaccine, they are required to give you a list of the possible side effects. And I'm telling you, they're terrifying. And I had personal experience of this, because last year before actually, when my daughter was a final year medical student, she did a spell in Ghana, I beg your pardon. She was in Ghana. In many sub-Saharan African states, you have to have the yellow fever vaccine or else they won't let you in. So a month before I had mine, a doctor had died. So I had to be given the full statistical chances of yellow fever. Death was actually quite high, because if you look at the last 100,000 to have it, there was one death. If you look over 30 years that the vaccine's been in place, you're looking at many millions of people who have had it, and some have died, but not 1 in 100,000. They have to tell you what the most recent numbers are. So the side effect profile was terrifying. Somebody like me, who's an ex-nurse, done my time, actually a lot of my career in the intensive care setting. I'm thinking, I don't want even the least risky one of these. I really don't want it. But you have to look at things in context and think, going to Africa, if I got yellow fever, I was pretty guaranteed death. What were my chances of contracting yellow fever? I don't know. Do I want to risk dead cert death against one in really 300,000 of a significant side effect? So I take the balance, I look at it, risk of death from this, risk of death from that, I'm going to have the vaccine. I was forced to. It was either that or don't go and see my daughter and spend some time with her on her medical placement. So I didn't actually have a choice, really. Mandatory vaccines, by the way, are an incredible intrusion into liberties. And they're required for entry into Africa to eradicate this lethal disease. So there's no choice. You have to have it. And in order to eradicate viruses, that is to reduce the hosts in which they can replicate to the extent they can then be moved over, is all what herd immunity is about. Now, with the coronavirus vaccine, I'm not 100% sure on the science here, but I only think you need 70% of people to be vaccinated or to have herd immunity of any long-standing basis in order to reduce the R value even more. So that's why they're not making it mandatory, is because we only need 70%. And I think they are rather blindly thinking that if we make it voluntary, there are sufficient people who will take it. They're wrong. There's a lot of hesitancy. And unfortunately, because of all the things I've said, they're not making the case for it properly.
As you pointed out, for immunity to be effective, and obviously there's a percentage of the population that needs to be immune to it for that to actually work. And as you say, the government are banking on the fact there'll be enough volunteers coming forward for that. And I think they're overplaying themselves in that respect. Well, the vaccination is going to be rolled out this week. We're going to see different categories within our country being given the vaccination. We don't really know what the effects are going to be. We don't know if it's going to have a substantial impact in people's lives, and more importantly, for us to get back to some kind of normality, because a lot of people are crying out. Sometimes the cure can never be better than the disease, and that unfortunately it has been in a lot of cases. And with Christmas coming up now, a lot of families getting prepared. I can't remember a Christmas like this. I'm only 45, so I'm still a young man. I class myself as young. I can't remember a Christmas like this, and obviously it's going to have impact on our children, education we've seen, and so much more. Here in Wales, the First Minister, Mark Drakeford, has cancelled pubs selling alcohol, slightly aside from the vaccination a moment. We've seen some crazy decisions made by both the UK government and here in Wales, the Welsh government as well, that sometimes don't make any sense, because they say they're following the science, but then they don't publish the science that they base their decisions on. And I just find that absolutely crazy.
I've always felt that there is this sneering arrogance over people thinking, well, the flock just won't understand. It will only confuse them if we tell them the truth. And we don't want to mix the messages. We don't want to fudge things. But because they are so desperately out of touch, they haven't worked out that there are people like you and me in society who are able to look at numbers, who understand statistics and science and look at it and say, oh, okay, well, that does make sense when you put it like that, because I can weigh, because I have critical thinking skills, I being all of us, oh yeah, I can work this one out. Okay, that makes sense. They have failed to do that. They really have failed to do that. The Swedish government didn't fail to do that. The Swedish government had a lockdown. There's no two ways about it. But they pursued the Boris Johnson 17th March strategy, which was please be sensible. And they were. Boris Johnson got pushed into this. And I think we would have adopted the cocoon the elderly. Sweden has huge lockdown restrictions in place. They were never legal. That was the difference. They were never legal. They were, look, there's a virus, it's nasty, you got to do this. Consequently, Sweden saw a higher rate than the other Nordic countries. When you take all of the arguments out about population density, behavioral differences, all of that, at the end of the day, you have to ask yourself, in 10 years' time, when you look at the Swedish mortality, will it be significantly greater than the other Nordics? That's the answer. Not now. It's too early to say, because they could have obtained some herd immunity. However, it is under an even worse lockdown now, Sweden. It looks like the UK lockdown. It's just not legal.
Well, look, Rebecca, our time is almost up. I know it goes really quick, and I know I'd love to talk to you so much more, and I'll definitely get you back on again. So I really found it very interesting and informative. I mean, we got Christmas coming up now. How are you going to be celebrating Christmas? I mean, it's going to be different to what it is every year. And what's your plans? I can't see your tree up in the background, but I can see some decorations up on your fireplace there. What's your plans for Christmas?
Plans for Christmas are to comply 100% with the government regulations, having my bubble, my 3 household bubble. I will not be sitting outside. Windows are probably open anyway. And I will just, very regrettably, I can't see my daughter because she's a doctor. I can't see her because she poses a risk to the rest of us, even though she's had the coronavirus. So I can't see the doctors in the family, but I can see the rest of the family. Everybody understands it's horrendous. And we're just looking forward to it all ending, frankly.
Yeah, absolutely. And if I don't speak to you before, let me be the first to say, I wish you a very happy Christmas and a much better and prosperous new year, and look forward to having you on again. And thank you to all of my viewers who have tuned in. Don't forget to check Rebecca Butler out. She's all across social media on Twitter and Facebook, and she's a wonderful person. I've been following her for many, many years, actually. I think, say from the Brexit campaign start or whatever it was. And just, I found your videos very interesting, very informative, and straight to the point. You pull no punches, which I've got to give you credit for, because a lot of people like to be politically correct. This show is not a politically correct show. That's the idea of it, to have all kinds of guests on. So I want to say thank you for tuning in today. Don't forget to hit that subscribe button, and I'll see you next week on Rich Politics.